I give my consent to be recorded and then video uploaded into a video cloud platform for the exclusive use of assessing this student's competency in the Advanced Health Assessment course at NU.
Okay, so we're going to start with inspection. Her chest is symmetrical. The anterior-posterior to transverse diameter is 1 to 2, which is expected. Respirations are even and unlabored. Respiration rate is about 14. She is not using any accessory muscles, so the sternocleidomastoid, the scalene, and the trapezius muscles are not sunken below the clavicle, and she's not using any intercostal muscles. She is sitting upright. Facial expressions are equal bilaterally, and they're relaxed. She's oriented ×4, and she doesn't have any peripheral cues, so her Shamrock's window, you could go like that, is present, so there's no clubbing, no nasal flaring, and no pursed up breathing. We're going to move to palpation, so if you could face the wall for me. We're going to do our thoracic expansion, about the 10th rib. If you could take a deep breath for me. You can see that our thumbs expand equally on both sides. You could face me again. We're going to do the anterior portion now. Same thing, if you could take a deep breath for me. Okay, we can see that my thumbs expand equally on the anterior portion as well. We're going to move to tactile fremitus. So if you could say 99 for me.
99, 99, 99.
We'll do the sides.
99, 99.
Okay, you could face the wall for me. We're going to do the posterior side.
99, 99, 99, 99.
Okay, and we can see while we're back here that her spinous processes there's no deviations and no tenderness. There's no lumps or masses on her chest or on her back. And now we're going to palpate for your lymph nodes. So we have the supraclavicular, the infraclavicular, and then we have under her arms, we have the posterior axillary, anterior axillary, lateral, which all feed into the central lymph node, and then we have her popliteal node back behind her knee on both sides. Okay, so now we're going to move to auscultation, to percussion. If you could face the wall for me. Arms across in front of your chest, please. We're going to percuss all the way down, and we're just going to hear for resonance turning into dullness. Okay. So right about here, about the same place on both sides. We're going to do diaphragmatic excursion. If you could just take a deep breath in for me and keep it in for me, please. Okay, let it out. Same thing, take a deep breath in, and we're looking for resonance turning into dullness. Okay, there we go. So we have it on both sides. You can take a deep breath in and then blow it all the way out. We're going to do the same thing on both sides. Okay, there we go. Other side. Blow it out. Okay, so we can see that they were equal on both sides. There was about a 3 centimeter difference, and normal is 3 to 5. So now we're going to take a listen to your lungs. We're going to listen at the apices, and this should be done skin to your skin all the way down, but we're going to keep your shirt on. Okay, take a deep breath. Okay, face the wall for me. Listen to your back. Deep breath. we don't hear any abnormal breath sounds, so we would not need to do the bronchophony, the whispered pectoriloquy, or the egophony. She has bronchial sounds over her bronchus, bronchial vesicular sounds over the bifurcation, and she has vesicular sounds over her periphery. If you could move to the couch for me. We're going to move this so you can see better. We're going to start the heart portion. So we're going to take a look at your thyroid cartilage on one side at a time to palpate for your carotid artery. We can see that it's 2+ pulsations. It's an even rate and rhythm. You could turn your head slightly to the left for me. We can still see the pulsations from the carotid, and then you have the jugular vein. It's invisible, it occludes, it is impalpable, it has a complex wave, and it empties from the bottom and fills from the top. So we know that it's the jugular vein. Pressure is measured by taking a ruler, finding the notch of Louis, and then we're going to measure the jugular vein distension at the point, and we see that it's about 2 centimeters. Normal is between 2 and 5. We're going to push on her liver and test the hepatojugular reflex, and we can see that the jugular vein does distend more. Anything over 4 would be abnormal, so over 4 from what we just measured. We're going to check your apices. We're going to check your heave and a thrill if it's present, and we can see that they're not. And now we're going to listen with the diaphragm of our stethoscope at the aortic. We're going to look at the second intercostal space for the aortic valve, pulmonic, Erb's point, tricuspid, and mitral. We could hear the S1 sounds, it's the AV nodes are closing, that's the lub. The S2 sounds are the semilunar valves closing, and that's the dub. So there's one lub for one dub, and no extra heart sounds and no murmurs. Now we're going to move to the bell. We have aortic, pulmonic, Erb's point, tricuspid, and mitral. And again, we don't hear any murmurs or extra heart sounds. If you can lay on your left lateral side. I'm going to listen to the apex. Okay, and we do hear that S1 is louder than S2. If you could sit up for me. We're going to listen to your bass. Okay, and again, we don't hear any extra heart sounds or murmurs. Skin is warm and dry, no lesions, no edema. She does have less than 3 seconds of capillary refill on both hands. Radial pulses are present. Brachial pulses are present. And then the trochlear nodes on both sides are non-edematous, non-tender, and they're movable, pea-sized. If you could lay down for me. We're going to look at her legs. Legs are warm and dry, non-edematous. They have no lesions. We're going to look for her inguinal nodes, which again are pea-sized, non-edematous, non-tender, and they're movable. So we have her femoral arteries. We have her popliteal. Then we have her posterior tibialis. And then her dorsalis pedis. And we can see she doesn't have any edema to her pretibial area. We're going to look at her toenail. She has less than 3 seconds of capillary refill on both sides. And we're going to take our microfilament and see that she does have present sensations on both sides bilaterally. All right, thank you.